A shakeup is coming to the Centers for Disease Control after review pointed to several missteps in how it handled the COVID-19 pandemic. Bradley Blackburn reports from New York.
CDC Director Dr. Rochelle Walensky is ordering an internal reorganization over the agency's COVID-19 response.
We need to have a special forces, if you will, to deploy during pandemic times.
A report out Wednesday commissioned by Walensky found the CDC had become too rigid and bureaucratic to act quickly. It specifically cited its analysis of data, the sluggish release of information to the public, and its confusing and overwhelming COVID guidance.
We learned some hard lessons over the last 3 years, and as part of that, it's my responsibility, it's the agency's responsibility to learn from those lessons and do better.
The CDC's reset comes as the agency works to contain another major public health crisis, monkeypox. The virus has been declared a global health emergency, with more than 35,000 cases now identified in 92 countries since the start of the year.
The next pandemic is around the corner. If it's not a pandemic, it's going to be another disaster.
Dr. Rita Berg specializes in public health responses to disasters at USC's Keck School of Medicine.
The emphasis on communication, the emphasis on timeliness, on collaboration, that is going to be the focus moving forward, and I think that's really where it needs to be.
In the coming months, Dr. Walensky says the CDC will focus on getting information to the public more rapidly, developing a more nimble workforce, and addressing equity in healthcare. Bradley Blackburn, CBS News, New York.
The CDC was established more than 75 years ago to deal with malaria.